So looking at the next menstruation issue that women could face, this is what is known as the luteal phase defect. So in menstruation we have the follicular phase, we have what? The luteal phase. Do you understand? So in the luteal phase there could be a defect, there could be a problem. You understand? So let's look at it. It's also called luteal phase deficiency. So it's a condition where the second half of menstrual cycle, that's the luteal phase. First phase is what? Follicular phase, right? They have the main ovulation, then luteal phase after ovulation. So if the luteal phase is too short, it should go on for about what? If you count it, about 14-15 days. If it is too short or insufficient to be able to support a pregnancy, it's supposed to be sustained so that pregnancy can occur if at all it is wanted. You understand? So what happens after ovulation? The body should produce progesterone to prepare the uterine lining for what? Implantation. So in luteal phase defect, either not enough progesterone is produced or the uterus doesn't respond properly to it. So it can lead to infertility or early miscarriage, as the uterine lining may not be thick or stable enough to support a fertilized egg. You get? So what are the different symptoms you might actually want to watch out for somebody that has a luteal phase defect? Maybe they are spotting between periods, right? Short menstrual cycles. Luteal phase is shorter than the normal 10 days. Okay, it's actually 10 days, right? It's short. Difficulty conceiving or recurrent early pregnancy loss. So they are getting pregnant but losing it too quick. Slow rise in basal body temperature. Okay, so diagnosis, there's no single test for this, but they just want to test for your hormones. So they can check for hormones like progesterone, follicle stimulating hormone, estrogen, luteinizing hormone. They just want to look at their levels, the normal levels. If it is too high or if it is too low, there's always a problem. Ultrasound, because you want to check your uterine lining thickness, right? Then they now monitor your menstruation cycle. Of course, that's like the most important thing. That's where they get to pick up that, okay, luteal phase is what? Short, right? The endometrial biopsy, okay, if they are suspecting cancer. So treatment options, so depend on your goal. Are you trying to conceive, or are you just trying to keep your life, right? So progesterone supplement, ovulation stimulation drugs. If you want to conceive, they will give you drugs that can stimulate release of an egg, like clomiphene citrate, human coronary gonadotropin. Then for the lifestyle changes, you try to reduce the stress, you try to maintain healthy weight, you try to treat any condition like polycystic ovarian syndrome, thyroid disorders, and all of that. Okay.